Friends, welcome to my workplace at Ranaghat, West Bengal, India. Let us observe this totally unedited surgery. This is a soft cataract with small pupil, and the patient is under topical anesthesia, and the patient is not at all cooperative. Patient is unable to cooperate. This is a totally unedited recording. Please watch. The main incision has been made. And now this is phenocane, which contains tropicamide, phenylephrine and lignocaine. Pupil doesn't dilate. The dilatation of the pupil in this case is hardly 3 millimeter. So we have to use some pupil expansion device to do a safe surgery. The patient is not at all cooperative. We can manage without pupil expansion device if the patient is probably under block. So this is a side port on the left side of the main incision, about 3 clock hours away. One more side port is made on the right side of the main incision, about same distance away. So the incisions are at 11 o'clock main incision, 8 o'clock one side port, 2 o'clock another side port. If the side ports are 90 degrees away from the main wound, the astigmatism induced by the main wound will be neutralized to some extent by the side ports. And now I am going to stress the pupil with 2 eye hooks. Gentle stretch. Now I go through the side port and stress 90 degrees away. Very gentle stress. My plan is to stress the pupil up to 4 millimeter so that the pupil expansion ring that I am going to use can be used nicely. And here is the pupil expansion ring, my friend Dr. Suven Bhattacharya's invention. It is known as B-Hex. It's a very thin device, goes through maybe 1.8 millimeter wound, and easily it goes. You have to use a B-Hex forceps for application of this device. Without this forceps, it is not a comfortable thing to engage the haptics, engage the notches at the pupillary border. The patient is, with repeated instruction, the patient is not able to keep the eye in primary position. So I had to struggle. Sometimes we have to do this. Sometimes we can use subtenon block in such cases, but I managed without that in this case. Some visco over the cornea and the visibility. And now I am going to use the utrata forceps to do the capsulorhexis. When you use the utrata forceps, you should always lift the anterior wall of the main wound so that leakage of visco is much less. Now hydrodissection. Hydrodissection is done with a 27 gauge cannula and BSS. The nucleus is tapped. And this is a very soft cataract. It is very difficult to hold such lens matter with Phaco needle. So I use this 2 instruments. One is a nucleus cutter, another one is a nucleus manipulator or nucleus sustainer, nucleus cutter or pre-chopper, whatever you say. And then the 2 instruments come out after dividing the nucleus into 2 heminuclei, and one heminucleus has been divided into 2 parts. And now the Phaco needle goes in with its bevel down, and then I start aspirating the lens matter. the free nuclear piece comes out easily. And now the thing is, the other heminucleus has not been divided into two pieces. So it is going to be, I have to do some manipulations to manage this. It is rotated. Now as I try to hold it, it is so soft it doesn't come. Ultimately it came and it was just eaten off. This is the epinuclear shell. And now by the handpiece itself, I am trying to remove some cortex. And it is done. Almost all the cortex is removed. And now this is SPMC again to fill up the capsular bag as well as the anterior chamber. And now the lens is to be implanted in the capsular bag. When the BHEX is there, I usually enlarge the main wound to about 3 mm so that the injector, the cartridge, goes beyond the BHEX ring into the anterior chamber. It goes, the leading haptic goes in the bag, and the trailing haptic is pushed beyond the BHEX and it goes in the capsular bag. Patient is always constantly moving his eye. In spite of repeated instructions, he was unable to keep the eye in primary position in most of the time. Now the BHEX is being removed. At this time the patient had little pain, maybe because the IOP decreased, or there's some other cause. There's some pigment dispersion. After removal of the BHEX, we have to remove those pigments. We have to be very cautious, very careful. These are the pigments. It was removed nicely. I go under the iris and remove all the visco that is under the iris. I didn't go behind the eye well with the Simcoe cannula. And now I take the bimanual irrigation aspiration. My plan is to go behind the eye well and remove visco from the space between the intraocular lens and the posterior capsule. Here it is. I have gone behind the eye well, irrigating. Aspirating cannula is in front of the lens. Be here for some seconds and then come anteriorly and remove all the visco. So nice cleaning of visco has been done. And now to reduce inflammation and to reduce the doses of topical steroids, I have planned injecting little bit of Cataract in this case and then wash out the Cataract. After washing out whatever Cataract molecules, Cataract means triamcinolone acetate, whatever triamcinolone acetate molecules remain in the anterior chamber, that will be sufficient to control the inflammation. This much triamcinolone acetate, and then it is washed out. After washing out, I found that there are a lot of triamcinolone acetate particles are still in the anterior chamber, and I didn't want so many triamcinolone acetate particles to be in the anterior chamber. So I wash it again with irrigating cannula of bimanual irrigation aspiration. Irrigating it nicely, the two air bubbles that were there also came out, and now it is looking nice. And now I am satisfied that a lot of triamcinolone acetate is not there in the anterior chamber. This is the final lavage and then formation of the anterior chamber with 20S3G Simcoe. And now the last step is, in this case, injection of little bit of moxifloxacin in the anterior chamber. Here it goes. Little bit of moxifloxacin is injected in the anterior chamber, as well as the Ondi's corneal stroma is hydrated. Thank you very much for your attention. Hope this video will encourage you to take challenging cases and manage such cases beautifully.